Hi everyone, we're at the end of February, which is the end of Black History Month, and I really want to round out the end of this month by talking about some really cool things in regards to Black history. So, two things. Did you guys know that Rebecca Lee Crumpler was the first African American woman to become a physician here in the United States in 1800s? And there was also James McCoon Smith, who was the first ever African American to become a physician. And so I know that I stand on the shoulders of greats, people who fought racism and all kinds of things just to achieve their goals and to be able to provide good health care for all of us here in the United States. So when we talk about Black History Month and all these great giants that we can see in American history, I also really want to focus on some things that do tend to affect African Americans, and those are health disparities. And so we have to be really cognizant to make sure that we're aware of these health disparities and that we do everything we can to fix those disparities that affect African Americans. There are three that I want to focus on. The first is cardiovascular health. The second is maternal health. And the third is mental health. So we're going to hit all three. Number one, cardiovascular disease. It is the leading cause of death in the United States. And unfortunately, it affects African Americans disproportionately. African Americans have a higher risk of cardiovascular events and death with us here in the United States. We're 40% more likely to have hypertension and diabetes, which are risk factors for cardiovascular disease. So what can we do to help and to close this disparity gap? Is to make sure that we're educating all of our patients, make sure that we're talking about food and diet and exercise and the importance of taking our medications so that we can decrease those risks and live a long and healthy life. Number two is maternal health. Unfortunately, in the United States, African American women are much more likely to have increased risk of maternal mortality, which is really maternal death. And that's for a few factors. Some of it is access to health care. Some of it is systemic racism and disparities that we have within the system. And so we really want to work hard to advocate for our patients. We want to make sure that we're providing good health care, but also educate our patients on signs and symptoms that could be the difference between life and death. For example, if a woman is more aware of the signs and symptoms of preeclampsia, which could increase our risk of maternal mortality, we want to make sure that we're educating our patients about those symptoms and make sure that we actually are advocating for patients to have access to health care, especially in African American communities where a lot of times the clinics are closing instead of opening. So if you want to help there, make sure you're an advocate, find out how you can help in your community, and if you need any additional resources, don't hesitate to reach out to us here at F.A.M. And number three is mental health. Well, there's always been a stigma for mental health, right? Anxiety and depression and bipolar disorder. And sometimes we don't want to admit that things are actually affecting our mood. So one way we can help with this disparity is to make sure that we provide access. Make sure you know about counselors in your area. Sometimes your jobs have something called an EAP program, which provides access to counselors. There's also psychiatrists, and there's also your primary care doctor that you can reach out to when life just seems to be lifing or when life gets really hard. And I think if we really make it a norm to be able to talk about our mental health and to be able to talk about our mood and to not create a stigma around it, it's going to open up access and really drive how our community is involved with each other and grows. And so if you ever need any help and you want to really address mental health, look for those community resources or reach out to us here at FAM and we can always direct you into the right direction. So now it's your turn. Take action. Make sure you support groups that support health equity. Make sure that you support groups that are advocating. Make sure you look at groups that are looking at policy change. Talk to your leaders in your community. And if there's anything that you can do, make sure that you get involved. And stay educated. If you make sure that you and your loved ones are educated about their own health, it's going to make a world of difference. So in conclusion, as we close out Black History Month, don't forget those giants we stand on, but also understand that there's still a lot of work for us to do. And F.A.M, along with other partners in our community, are very dedicated to making sure that we decrease these disparities in our own community.